Hello, good morning. Today we will present you a case studies project about smart pill dispenser, and the member of the group there are DEVINA Putri ARIYANI, DIVI RAHMI, and IRFAN YONAF. Next. What we will discuss is the definition of smart pill dispenser, application and case studies, benefit, limitation, ethical issues, and conclusion.
So what is IoT? IoT stands for the Internet of Things, a system where physical devices are connected to exchange and process data in real time. In healthcare and pharmacy, IoT tools are reshaping how we work and care for people, from tracking medications, adherence, to managing inventory. This device bridges gaps between patients, pharmacists, and providers. Now, why does IoT matter in pharmacy? Historically, pharmacy has been about dispensing medications, but IoT shift that focus to monitoring outcomes. Imagine sensor that monitor vaccine storage, pill dispensers, when a refill is due, when we have to take the medications. These tools make process smarter, faster, and patient-centered. This evolution is something Divi will explore further when she talks about specific applications, like smart pill dispenser real-time inventory control. IoT matter in pharmacy. Historically, pharmacy has been about dispensing medications, but IoT shift that focus to monitoring outcomes. Imagine sensor that monitor vaccine storage, pill dispensers, when a refill is due, when we have to take the medications. These tools make process smarter, faster, and patient-centered. This evolution is something Divi will explore further when she talks about specific applications, like smart pill dispenser real-time inventory control. Okay, a standout example of IoT in pharmacy is the smart pill dispenser. It's not just a device, it's a lifeline for patients managing chronic illness, complex regimens, or just juggling life in general. These dispensers work by releasing medication on a schedule, sending reminders, and even notifying caregivers if a dose is mixed. They connect to apps and cloud system, providing clear picture of how medication are being taken, and the data it help healthcare provides make smarter, more personalized adjustments. It's incredible. It's just one piece of puzzle. Divi will soon share how similar tools are being used in pharmacies worldwide, and later Devina will discuss the real-world impact, including the limitations like accessibility costs and the ethical challenges of using IoT device in healthcare. To wrap it up, IoT in pharmacy, and specifically tools like the smart pill dispensers, represent a fundamental shift. It's about moving from a reactive system where we fix the problem to a proactive one where we prevent them. Thank you. I'll now hand it over to Divi, who will take us further into the exciting work of LT applications.
Next is the application and how it works. The dispensing mechanism is automatic and electronically controlled. It can separate and dispense pills in predetermined amounts and times, equipped with sensors and controls to ensure pills are dispensed at the correct dosage. The cover may block access if it is not the scheduled time to prevent misuse or overconsumptions. Connect with an app, example smartphone, to set up a medication administration schedule, give alerts to reminders, send notification if a dose is missed or the dispenser is not working. The case studies we have what Lewis and friends do is automatic pill dispensers and method of administering medical pills. To conclude the abstract, he said that this automatic pill dispenser has 12 rotating compartments that release pills at scheduled times. Photoelectronic sensors detect the dispensed pills and alert the patient to take them. Preload canisters from a pharmacist can also be used for added convenience.
Next is the benefits. First, help user remember to take their medication on time, thereby improving adherence to medication schedules. Second, with smartphone app support and Wi-Fi connectivity, users can receive notification and control the dispenser remotely. Third, the refillable and reusable design makes it environmentally friendly and economical. Fourth, it can record medication adherence and communicate in real time to ensure treatment is followed correctly. Next is limitation. First, smart pill dispenser depend on internet connection and electrical power. In the event of a network outage or power failure, the device functionally may be disturbed and patient may not receive their medication on time. Two, smart pill dispenser usually only remind or dispense medication, but cannot monitor overall health condition or adjust doses in real time. For ethical issues, patient health data recorded by the device must be kept confidential. The risk of data leakage may raise ethical concern regarding patient privacy. Uh, in the event of a device-induced medication error, it needs to be clear who is responsible, the manufacturer, the provider, or the patient. Next. Conclusion, smart pill dispensers show how Internet of Things shift pharmacy toward connected, patient-centered care. They automate doses, send reminders, and support remote monitoring, especially for elderly patients. Despite benefit, they rely on power and internet and raise data privacy concerns. This is our reference. Thank you for your attention.
Good morning, everyone. So in this case studies, we will discuss about wearable biosensors for adherence, and the member of the group, there are DEVINA Putri ARIYANI, DIVI RAHMI, and Muhammad IRFAN YONAF. What we will discuss is the definition of wearable biosensors for adherence, applications, and case studies, benefits, limitation, and ethical issues, and the last one is conclusion. A brief overview about IoT in pharmacy is IoT technologies in pharmacy enable real-time health monitoring through wearable biosensors. This device track data like glucose levels and heart rate, sending it to apps for analysis. They support medication adherence, remote monitoring, and personalized treatment, making pharmacy more efficient and patient-centered. The definitions itself about wearable device biosensors for adherence is an inaccessible biosensor system that is part of a research program that seeks to measure, understand, and improve real-time therapy adherence. The other definitions is described below. So next.
One example of a type of wearable biosensor is Wearance, which is a smart necklace with piezoelectric sensor. For the application, first, the process starts when the bottle is first opened using smart bottle technology. The movement of the smart pill bottle is combined with a swallowing detection algorithm to detect drug consumption, which is then reported to a mobile app with cloud integration. Second, the mobile app uses several algorithms to classify the data into upward categories: saliva swallow, medicine swallow, chewable vitamin swallow, and none. Third, when the patient swallows the pill, the piezoelectric sensor exerts pressure on the signal sensor as it sits flat on the lower part of the neck, just above the collarbone. Swallowing causes movement in the skin. Fourth, after the piezoelectric sensor data is acquired by the microcontroller and sent to the cell phone. Fifth, spectrogram analysis of chewable vitamin ingestion resulted in a stable and long-frequency distribution, whereas capsule ingestion showed the typical short-term high-frequency spikes around the time of ingestion. This is an example of spectrogram time domain waveform for vibration sensor data of capsule swallowing and swallowing chewable vitamins. Next.
So now that we've seen how LT is applied in pharmacy through tools, thanks to DIVI, and after hearing Davina's breakdown of its real-world applications, I'd like to focus on one specific innovation that's getting a lot of attention, the wearable biosensors. Why does it matter? Wearable biosensors are not just fitness accessories anymore. In healthcare, they can monitor vital signs, track physical activity, and even detect whether patients has taken their medications or not. That makes them especially useful for improving medication adherence, which is still a major challenge in clinical care. These devices aren't just recording data, they're helping shape behavior and enabling real-time interventions when something is not right. Now, moving on, let's talk about the benefits first. First, they provide real-time, objective, and continuous data no more relying on patients' memory. Second of all, healthcare providers can respond faster, tailor treatments, and prevent complications before they escalate. And the last one, for the patients, adds a layer of accountability without needing constant human supervisions. So in a way, biosensors act like a quiet but reliable health assistance, always monitoring, always ready. But of course, nothing is perfect. There are some clear limitations too. First, cost. Cost is a big one. These devices are not cheap and not everyone can afford to use them long term. Second, then there's wearability. Some people forget to wear them. Some get skin irritations and others just don't like being tracked. And the accuracy of the data can vary depending on things like skin tone, movement, sweat levels, which raise questions about inclusivity and design fairness. Into the ethical stuff. When a device is constantly collecting sensitive healthcare data, we have to ask who owns that data? How is it stored? Who can access it? There's a fine line between helpful and invasive. Consent, transparency, and data security are absolutely essentials. We also need to push for bias-free design because if it only works well on certain bodies, it's not working at all. So, while wearable biosensors offers a lot, especially in helping patients take their meds, they also come with questions we have to ask. They are a powerful tool, but like all tools, they need to be used carefully, ethically, and equitably. Sorry. Thank you.
And the conclusion, biosensor technology, both ingestible and wearable, plays a crucial role in improving patient adherence and real-time health monitoring. Integration with AI and smart devices enables early detection of non-adherence and personalized treatment. However, challenges such as data privacy regulation and system integration must still be addressed to fully realize the potential of this technology. And these are the reference that we use. Next. Thank you for your attention.